If you or a loved one have cancer and you're trying to figure out, will Medicare be good or bad? I want to share this important video with you so you understand what to look for so that you can have the best coverage as well as the lowest cost for those. So I'm going to walk through kind of things to look at and some shortcuts to be aware of or some things to be aware of to help you save money on your Medicare costs when it comes to your cancer or really any other serious health condition treatment. I'm Emily with the Medicare Coach. We are an independent consultant helping our clients easily navigate Medicare rules and insurance company options to do what's right and best for you. We are not an insurance company, an agent, a broker, the government, so you'll hear me say very different things in this video. I'm also going to share some extra shortcuts, some extra tips for you down below in the workshop to give you a jump start when it comes to Medicare. So let's talk about cancer or any other serious health condition when it comes to Medicare. The thing is, Medicare can be really great coverage if you have the right Medicare plan. So the first part means like, which plan do you have? I'm very focused on getting people the right Medicare plan when you first join Medicare. Because once you have health issues, you are not guaranteed, in most states at least, to go back to a Medicare supplement plan. I say this because in most cases, when people do have expensive health conditions, original Medicare with a supplement tends to provide the best coverage for you having the lowest out-of-pocket costs. Now, I've had clients with stage 4 cancer who are best on Advantage, mainly around their network and their doctors and what they accept. But it's important to know that the different programs give you different options and will have different costs with them as well. I cover that in a lot more detail in other videos or on my free workshop, so check those out. So it all begins with your program. Now, if you're already on Medicare, we can make certain changes like your prescription drug coverage or your Medicare Advantage plan. But again, we're not guaranteed to go back to a Medicare supplement. So no matter where you are, there's a few things that I want you to be aware of. Number one is really around your treatment, your medications, your things like that. And Medicare has a distinction between how a medication is administered to you. So if you pick up a medication from a pharmacy, like if you were to go to CVS and get your chemo pill, it'll be covered by the Medicare Part D or the prescription section of your Medicare Advantage plan. They tend to be quite expensive to get from your pharmacy because of how the whole thing works. So this is different from getting a medication administered you at a medical facility. I'm working with a client right now who gets an injection once every 6 months, and it's saving her $10,000 by having her doctor administer it to her because it's covered by Medicare Part B and not Medicare Part D, okay? Advantage can be expensive as well when it's on covered by Medicare Part B service, but my point is, depending on what type of medication you have, there can be big cost differences. So while it might be great to have a chemo pill, it might actually be way less expensive to actually go to the doctor and have chemo injected into you. Again, I'm not a medical professional. I want to talk to you about how Medicare works and how the billing works. So be aware that how a medication is administered to you will impact what you pay for that treatment. Now, in some cases, you are better off getting that pill or that treatment from a pharmacy, which is covered by the Medicare Part D drug coverage. In that case, be aware of two things. I tend to find recently that the generic version of that chemo pill, of that cancer pill, tends to be more expensive than the brand name. So please run this different scenarios to understand which is cheaper and which plan covers those the best so you can save yourself money. I mean, it can be a couple $1,000s difference, and so I think it's worthwhile to check generic versus brand and do not assume that one is cheaper than the other. So be aware of that. Number two, when we have clients who have very expensive medications, whether it be cancer or anything else, and Medicare does not cover it at all, we now have this $2,000 cap, which is great for covered medications. But if it's not covered, there are other places that we look at to save money on those prescription drugs you get from a pharmacy. And one of those is by talking to your doctor and asking your doctor, one, do you have samples? Two, do you know of a coupon program or the discount program through the pharmaceutical companies? While they tend to say that those pharmaceutical company discounts don't apply once you're on Medicare, there can be some exceptions to that. So please ask the question to your doctor, okay? Number three, we will also look at Abbvie, ABBVIE.com. They have resources on there to also help save you money when it comes to your prescriptions. It's usually best to apply for those discount programs, those extra cost savings programs at the beginning of the year or at the end of every calendar year, because that's kind of how the program will have a certain amount of money. They'll approve the first ones first, then when they run out of money, they're kind of done. So be proactive. But my point is, please do not assume that if a medication is expensive per your Medicare plan, that there is no other option. There are usually options. Again, administered by a doctor will likely save you money in most cases, or even looking at other coupon programs, samples, other programs that can help you pay for your medications. It is worthwhile to look at your options. Again, I want you to have the best treatment or whatever your doctor wants for you. So let's look at the levers that we can pull when it comes to Medicare to ultimately get you what you need at the lowest cost. Now, we can't solve everything, but a lot of things we can solve by looking for alternatives and seeing what exists and having those conversations with your doctors. So I hope you found this helpful. Again, share this with those of you who have cancer or any other serious health issue, because it can be helpful to walk you through Medicare to, again, save yourself money, and you can focus on just getting yourself better. So hope you found this helpful. Make sure you follow along for more inside tips.